Hi, I'm Beth Battolino, CEO of Healthy Women. Thank you for joining us today on Healthy Women's first talk show, WomenTalk.
Hello and welcome to WomenTalk. I'm Beth Battolino, CEO of Healthy Women and your host of WomenTalk. Super excited to bring you a two-part series on the importance of heart health in women. In this first episode in our series, we're going to talk about triglycerides. Triglycerides are the often forgotten or ignored numbers in a cholesterol panel. But thankfully, we have my dear friend and member of Healthy Women's Women's Health Advisory Council here to tell us why we need to pay attention to triglycerides. Dr. Nieca Goldberg is a cardiologist, women's health advocate, and author. She has a strong commitment to advancing heart health for all, from prevention to treatment, and has a deep passion for women's health, which she and I share. She has dedicated her career to serving that passion and to advancing heart health, from starting the Go Red for Women movement to being a podcaster, a clinical associate professor of medicine at NYU Grossman School of Medicine, all the while continuing to see patients at NYU Langone Health. Welcome, Dr. Goldberg. We're so lucky to have you again on WomenTalk today.
Beth, it's always great to spend time with you, and this is such an important topic.
So let's dive right in. Heart disease continues to remain the number one killer for both men and women in the United States, yet is still considered a male-focused disease. Why do you think that is?
I think in the healthcare system, it's tough to break old myths, like heart disease is a man's disease. And it is really important for us to hit home, not only to the patients that we see, but also to primary care doctors, obstetricians and gynecologists, rheumatologists, and anyone who comes into the care of women about evaluating their cardiovascular risk.
We know that there are a number of risk factors for heart disease, including one that I feel is forgotten, which is the high triglycerides. Can you tell us a little bit about what they are and how they're different from cholesterol?
Well, high triglycerides are one of the components in a standard lipid panel. As in practice, before I order the test, I explain what we're looking for to my patient. And so the standard lipid panel gives you the total cholesterol, the level of good cholesterol, the HDL, the LDL cholesterol, which is the bad cholesterol, and triglycerides. And both LDL and triglycerides increase your risk for heart disease. Triglycerides is that a blood fat that we have that actually promotes the buildup of cholesterol in the arteries. It's not found in that plaque that is in the walls of the arteries. Actually, oxidized LDL cholesterol is in those plaques. But we know that it's a promoter of the process to start laying down the cholesterol in the arteries.
So let's talk about the blood test. Now, is that something that I would get annually, like a lipid profile, or is that something I have to ask specifically for?
Generally, it's commonplace that in women over the age of 40, they get a yearly cholesterol panel. Between 20 and 30, the cholesterol testing may be less frequent, particularly if you're someone who has a healthy cholesterol level, so the frequency is less. As women get older and go through perimenopause and menopause, triglyceride levels actually increase.
Okay, so that's really important for our audience to know. So if, as they go in for their annual women's wellness visit, they'll normally, the blood panels that part of the annual women's
It's
wellness.
part of the annual visit, like the comprehensive panel, which gives your electrolytes, kidney and liver function tests. your CBC, which gives you your white blood cell, red blood cell, hemoglobin, and hematocrit. And I know that many people have their vitamin D level checked as part of the annual visit, in addition to maybe getting an electrocardiogram and your doctor making sure that you're up to date on your mammograms.
No, I thank you for pulling that all in, because super important. But I guess, I know you and I know how thorough you are with your patients. But if your health practitioner calls and says, well, your numbers are a little bit high, that drives me crazy, because I just want to know your numbers.
Yes,
Right?
I know. I mean, what does that mean, doctor? I mean, I think every woman listening to this, if I could hit on one message, is if your doctor says they're a little high, you should say, what do you mean by that?
Exactly. So can you give me what's considered normal and what's considered high?
So a normal triglyceride level is 100 less than or equal to 150.
Okay.
Above that is elevated. It gets a little complicated when it comes to the LDL cholesterol, because there are different levels based on your risk for heart disease. So generally acceptable for people who have no other heart disease risk factors and you don't have a early family history of heart disease, around 100 is good.
Okay.
Or a little less than 100. But when someone has heart disease or at high risk, we're looking at numbers of less than 70.
Okay, so that's great to know. And do they, so these numbers, will they affect triglycerides? Will they affect like a person's risk of heart attack or stroke?
They're an independent risk factor for heart attack. High triglycerides are an independent risk factor for heart attack. I want to also point out there are certain conditions that women have that can increase where we find high triglyceride levels,
Okay.
like PCOS or polycystic ovary syndrome. That's a combination of having elevated blood pressure, glucose, belly fat, and high triglycerides, and sometimes low levels of good cholesterol.
So it is important for these women to understand their numbers. I'm just going back.
Absolutely. It's important. And if you know that you have PCOS and don't even know your cholesterol level, you should talk to your doctor about getting one.
Awesome advice. I love that. Let's talk about like lowering them. Can we lower them on our own, or do we have to, like, if I have high triglycerides, do I immediately need to think about going on a medication?
It depends upon how high. For triglycerides, when we see a triglyceride level is elevated, it depends how high is it.
Okay.
If there's only mild elevation between 150 and 200, maybe a little over 200, we have a counseling session about diet and exercise.
Okay.
So for instance, triglycerides are very responsive to a combination of aerobic exercise. That means walking, running, jogging, cycling, dancing, swimming.
Okay.
Those are aerobic activities. Or another way of thinking about aerobic activities is when you're moving your large muscles quickly. That's aerobic. And you have to combine them with a diet that focuses on reducing your intake of starches and sugars. So when I mean sugars, that's cakes, candy, baked goods, and alcohol.
Okay.
Okay. High levels, heavy drinking raises triglycerides. I want to point that out.
No, it's important to point out, because I really think during COVID, we definitely heard from our audience that more and more women, especially, were drinking more because they were home. You're not in the office, you're making dinner, and every night. I know friends of mine that used to only drink on Fridays and Saturdays, but
right. It was a nightly thing.
Yeah.
Well, it's not only about the increase in alcohol consumption during the pandemic. People are also baking sourdough bread. And together, those could really have the ability to raise your triglycerides. And white floured foods. So, pasta, bread, white rice. I mean, these are things. So it's not only important to talk about what you shouldn't be doing, but it's also important on what are some of the other options to fix it. And one other added thing is saturated fat. So that's fat found in butter, meat, and fried foods.
So if we're looking, so cardio, like you were saying, aerobic exercises really helps. And then I know you're a big fan of the Mediterranean diet.
Yes.
So
and the Mediterranean diet has a lot of benefits. It helps to lower blood pressure, lower risk for heart disease, lower blood sugar, and improve triglycerides. So that's the diet people should be looking for. And it's really important to understand. There was once, a really long time ago, a study where people with heart disease were randomized to getting a Mediterranean diet. And it showed that they had a lower risk for recurrent heart disease. These people all had heart disease. It lowered their risk for recurrent heart disease, but they found the findings like 5 years early. It was just overwhelming, the benefit. And then they asked the people to stay on, to continue to follow them. And they followed it, and they said 95% of people still were following the diet. And that you don't get that kind of compliance to a research study, even with people calling you up all the time to remember to participate.
It's so interesting because I like the Mediterranean diet, and I don't even want to call it a diet because I feel like
it's a style.
It's like the big X, right? But it's just it's a way of eating healthier, and I don't feel like you're missing out on anything.
No, and part of the reason why it's so popular is there's a lot of variety, and it's fruits, vegetables, whole grains. It's it's low in meats and sweets,
right.
And it's sort of a very creative diet. There are always ways that you can modify what you like to eat along a Mediterranean style, using some olive oil. And I really enjoy myself some of the recipes from the New York Times app.
Yeah, no, it is great. It's an easy to follow pattern or way of eating, I should say. I'm not going to use the word diet. And I think everyone can include more exercise, and so that's a great strategy or way to lower your triglycerides a little bit. But let's talk, like, if I'm someone that has to go on medication, so a statin or a fibrate, and then we're also hearing more, and I know when I'm watching TV, it's like bombarded with commercials on omega
medicines,
right? Like omega.
Right.
This is going to be the pill that like keeps you living until 105. It seems like
it's either paper towel commercials or medicine commercials.
Exactly.
It's really wild. So let's talk medicine.
Yeah.
And I think it's really important for people to understand the role of a medicine and what it does. So statins lower LDL cholesterol.
Okay.
That's the bad cholesterol. And they've been proven to lower the risk for heart attack and in people who've already had heart attacks from having a second one. Fibrates are a cholesterol-lowering medicine that they've been around for a while. And although they can get small lowering they have small reduction in LDL cholesterol, they're really focused on lowering triglycerides.
Okay.
So fibrates can effectively lower triglycerides. But one of the things that fibrates don't have is data to support that you lower the risk for heart disease when taking it.
Okay.
In fact, so a way to look at this is with fibrates, you can fix the number, but you may feel really good about that, but you don't lower your risk for heart disease.
Okay, that's
and I want people to understand that I know that that's a difficult concept, right?
Yeah, because you're getting
take care of patients too. That's like, well, I'm taking it, things are better, and that means I won't have a heart attack. And it doesn't work that way. The research shows that a medicine can actually lower your number of the amount of triglycerides you have, and it could be well tolerated, meaning you have no side effects, but it doesn't necessarily reduce your risk for heart disease. So why would you use this medicine, you might ask? Well, sometimes people have very high triglycerides, like levels of 500. And that level can actually increase your risk for having pancreatitis, which is a serious condition. So that might be one of the areas where that would have a role. But if you've just had a heart attack and you have a combination of mild to moderately elevated triglycerides, elevated LDL cholesterol, well, if you've just had a heart attack, you'll definitely be on a statin because you get one automatically when you have a heart attack. But then you have the triglycerides that are elevated.
Right.
And so then we prescribe fish oil.
Okay. So this is
omega-3 fats.
All right. So talk to me about what's the difference between over-the-counter omega-3 and the prescription.
Okay, so we'll talk about when I'm taking care of it, when someone comes to a cardiologist and they have high triglycerides and they're at either high risk for heart disease or they've had heart disease, then we're talking about prescription omega-3s.
Okay.
And one of the prescription drugs we use is called icosapent ethyl, which is a purified form of omega-3 fats that we give by prescription that lower triglycerides. And the interesting thing about prescription fish oil with icosapent ethyl is there has been a study to show that when given to people with high risk for heart disease, it lowers a person's, when they take the prescription fish oil or omega-3, they lower their risk for heart attack by 25%.
That's a big percent.
That's a big percent, but we also have to look at the people who benefit most from that. It's people who are at high risk for heart disease and have high triglycerides.
Okay.
Now, there are a lot of commercials for omega-3 fats too that are sold over the counter.
Yes.
In addition to some of the prescribed medical commercials that we see. Mm-hmm. So in the over-the-counter fish oil is a combination of EPA and DHA, two types of omega-3 fats. It's not the purified one. Those are bought over the counter, so that means that the FDA doesn't supervise that. So sometimes it's possible that not all the capsules in a bottle are equal. And it's interesting that before we had prescription omega-3s, we would recommend some over-the-counter fish oil.
Right.
Over-the-counter omega-3s. But you would see that sometimes it was hard to predict how much lower you were getting the triglycerides because not all the capsules were equal. But Beth, one of the things I see in clinical practice, or I hear some of my friends ask me about, is the fact that people are just taking omega-3 because they find that it prevents heart disease. And the over-the-counter products were never studied for that. And people with high LDL cholesterol ask, oh, should I just take over-the-counter omega-3? No, I said, but that doesn't lower LDL cholesterol. So you shouldn't be taking things that are not going to make a difference.
I love that. And that's why I love you so much, because you just say it the way it is. So if you have high LDL, just taking over-the-counter omega-3 is not going to
lower LDL. It's
not going to lower LDL. If it's high, and I'm going to say the numbers and correct me if I'm wrong, but if it's higher than 200, would you consider putting someone on medication?
The triglycerides, yeah. So I would certainly be concerned if people have triglycerides of 200 to 250
Okay.
that we would start to treat. There are some people at the 200 level that they've not yet started the diet and exercise program.
Right.
So I would give them a 3-month trial at that to look at the triglycerides.
Probation period, 3 months.
Probation.
Yep.
The probation period where you have to exercise and change your diet. And then there are the people at 250 and above that I would start them on prescription omega-3.
That's great. And so if I just said to you, because you're kind of reading my mind right now, so after this, I know my triglycerides aren't high, but should I be taking a prescription omega-3? What would your answer?
No, you should take a prescription omega-3 if you have high triglycerides and at a high risk for heart disease.
Okay, I love that. And that's where we're going to end this Women Talk. Straightforward information from one of the best cardiologists I know, Dr. Nieca Goldberg. Thank you so much for joining us. And thank you for this important conversation on women's health. And I need to thank Amarin for sponsoring this episode of Women Talk. For more information, please visit healthywomen.org and tune in for our next episode on diabetes, heart disease, and stroke in women. Thank you.
Thanks for joining us for another episode of Women Talk. Stay tuned for more Healthy Women live events at www.healthywomen.org. You can also follow us at Healthy Women on Facebook, Twitter, YouTube, or LinkedIn, or follow us on Instagram at healthywomen.org. We'll see you next time.